Welcome back to the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're talking about back pain during pregnancy, which is super relatable because I am pregnant myself right now. If you're pregnant, I want to hear from you. Have you been having any pains, whether it's back pain, pelvic girdle pain, SI pain, sciatica? What has been going on? Maybe carpal tunnel. That happens a lot too. Now, I have a lot of videos that cover specific exercises that you can do for all of this, but we want to talk about specifically back pain because there's so much misinformation out there that I think can be really beneficial. And I've actually started to experience some pains myself. So I want to hear from you. Like, what have you started to experience? And we'll talk about what you can really do. But don't forget to hit subscribe because we have so many videos, again, not only for pregnancy, but for so much that can support your entire body. We can see from this one study that we have pulled up, low back pain during pregnancy. It's estimated that about 50% of pregnant women complain of some sort of back pain at some point in pregnancy or during the postpartum period.
Why? Why are we starting to feel these pains other than the obvious, which I guess the obvious, like you're pregnant, starts to explain a lot of different things. Like you have this growing baby in your uterus is growing. And one major thing that does is it shifts your whole center of gravity. Mm-hmm. And it shifts your whole center of gravity forward a bit with that belly growing out forward. And that does a bunch of different things to our mechanics, to our standing posture, to just our body's ability to move in the rib cage, in the diaphragm.
And your body is always looking to seek its lowest energy form. Wherever it's moving, I'm just going to follow. For example, if my head is going forward into a screen, I'm just going to round forward because that's what feels comfortable for my upper back then. So the same thing, if my belly is starting to shift forward, it's probably very common for my pelvis to then anteriorly tilt and kind of shift forward into my hips. And I'm going to get a little bit more of that forward pressure. And then what ends up happening sometimes is we notice a little bit of external rotation of those legs.
Because when our pelvis tilts anteriorly, technically, if we don't move our legs, they're more internally rotated. Mm-hmm. And that might feel uncomfortable. And like you said, our body wants to seek that homeostasis.
Right. So then you start getting into that waddling pattern of pregnancy, especially later on in pregnancy, right? You feel like you're waddling back and forth, your feet are turned out, your hips are forward. But what this does when we have external rotation of those feet and those hips going forward, we're putting a lot more pressure into that low back area, into that SI and that pelvic region. And so it's then going to be more common that we're going to start to feel more symptoms because the brain is registering whatever we're putting on a habitual basis. So if now all of a sudden I'm shifting my center of mass and I'm putting more pressure in a certain area, your brain is going to be registering that as like, oh, that's new, that's uncomfortable, along with all the hormones and different ligament changes that we're getting as well. That's also causing shifting and movement. That's good. That we want, but it can register into the brain as this is different and we can feel pain.
With the growing baby, it gives our rib cage and our diaphragm less space to move. Mm-hmm. So we almost start to get this forced anterior flare of the rib cage, and our diaphragm doesn't want to descend as much because then it's going to be pushing into the baby and an area that we already don't have enough space, and so we aren't able to get as full of breaths. We aren't able to compress our rib cage as much to do true diaphragmatic breathing. So we might seek out breath in other ways by breathing through our upper rib cage, which is going to contribute to other things as well, maybe neck tension, upper trap tension, but also is a more stressful breathing pattern. Mm-hmm. It's something that's going to activate our sympathetic nervous system a little more versus parasympathetic. So that adds into this whole kit and caboodle of adding stress. When we have more stress or in a more sympathetic state, our perception of pain is a little bit elevated. And you mentioned the pelvis a little bit, and just in general, we're having these ligamentous changes. When you brought up the stats that 50% of people feel pelvic pain prior to the 20-week mark, that kind of makes sense because that's when relaxin, this hormone, is really going into effect to give all these ligaments a little bit more laxity. And again, people start to try and say, oh, your pelvis is unstable, which is also something that we want to start to strike down. We see more as like harmful language because people are thinking, oh, my pelvis is unstable, I can't move.
Yeah.
When in reality, even with this ligamentous laxity, our pelvis is super stable.
Well, and that's what I want to talk about because there was actually a cool study done in 2022 about reframing beliefs and instilling facts for Contemporary Management of Pregnancy Related to Pelvic Girdle Pain. And I love this paper because it says common narrative perpetuated in the clinic and in medical care in general include misleading statements about pain being normal in pregnancy as if there is nothing to prevent or treat it, the belief that pain will immediately stop after delivery, and that pelvic girdle pain is due to poor posture or alignment. And these all create false belief of fragility and inevitably of pain. And so this is why it's so important to understand pain is complex. We've brought up some biomechanical stuff that's happening in the body, but we have to even look beyond that when it comes to pregnancy related pain. Are you now doing less activities with your friends because you are preparing for baby, or they're doing activities that you don't feel comfortable doing pregnant, so you're not maybe getting as much social interaction as you normally did before, or you feel like you've been told by your provider, don't lift more than 20 pounds, so now you're not working out, or now you're not doing certain things. And so all of this mental stress and mental state compounds and adds to the experience that we feel in pain. And so this is so important that we take this in, especially if you're super nauseous in the very beginning. You're not eating the things that you normally would. Like you're uncomfortable with sleep, you're not sleeping well, maybe you have insomnia. Like this all increases our perception of pain and experience within the body. So we have to understand that it's not just postural related and it's not just alignment related. There's so much more. Of course, we want to look at that and we want to say, okay, what we can do, which we're going to talk about, but we also have to take in these other factors and acknowledge them. And the moment you start acknowledging things that could be contributing, I'm telling you, the pain levels are going to start to decrease.
What do we do?
Yeah.
And I think you brought up one thing that a lot of people hear when they start going to their OB appointments is like, okay, you're pregnant now, so for exercise, don't lift more than 20 pounds. Or something to that narrative of like, now you're pregnant, so stop exercising or don't exercise as much. If that's the first thing that you start to hear in your OB appointments, I would have a ton of pause about how that person is going to consult with you and guide you through the pregnancy, especially if you're someone who's already active, already lifting, already exercising. Because the newest guidelines or most up-to-date guidelines from ACOG, which is the American College of Obstetrics and Gynecology.
So not just what we're saying.
Yeah, was put out in 2015. And there's a few different points, but some of the main ones are women with uncomplicated pregnancy should engage in an aerobic and strength conditioning exercise routine. Done. Pretty straightforward, right? You should. This is not like, oh, you can, but you should be doing this. A moderate intensity exercise program, they say equivalent to 13 to 14 on the Borg scale, which is a scale of 6 to 20. But essentially that's meant to mimic your heart rate. So 13 to 14 is 130 to 140 beats per minute in your heart rate, which it takes people a good amount of activity to get there for at least 20 to 30 minutes a day or 150 minutes per week, which is similar to the regular recommendations for the average person, which I also love to see that. Physical activity in pregnancy has minimal risk and is beneficial to most women. Some modifications may be necessarily, making sure you do consult with your OB as you're doing these things to make sure that none of the things you're doing are landing outside of guidelines or might, for some reason, you might have different restrictions or precautions, but that's it. And they go on to say, like, regular physical activity during pregnancy improves or maintains physical fitness, helps with weight management, reduce the risk of gestational diabetes, and enhances physiologic well-being. And I think that's the main point that we're getting at. All of the physiologic benefits that we know come from aerobic exercise, strength training, and just being active outside, moving in general.
And, I would encourage you to go listen to episode 359 with Dr. Christina Previtt, who's another physio, who talked through why the recommendations for so long were not to lift more than 20 pounds, like where that really came from in a study. But it's so old and it's so misleading in terms of why it was said in the first place that it should not be used anymore. And there was a study that we looked at from this is 2018, and it just says, compared with not exercising, prenatal exercise decreased the severity of low back pain, pelvic girdle pain, and low back pain postpartum during and following pregnancy, but did not decrease the odds of any of these conditions at any point. Meaning, we can't say that when you exercise, you're going to prevent all of these pains. However, if we can decrease the severity and allow you to function, and that's what's so important. I had one of my best friends all throughout her pregnancy. She had severe severe pelvic girdle pain. And she saw chiropractors, massage therapists, pelvic floor PTs. But the number one thing that helped her function every single day was exercising. She noticed if she did not exercise, she had more pain and more dysfunction within her body. And so she had to work out just because she had pain. And again, this didn't take away the pain, but it allowed her to function and feel less pain throughout the day so she could actually do her daily activities and help support her body postpartum, because postpartum is tough. You're bending down, you're lifting a baby, you're caring for a baby, you're doing so much postpartum. Think of strollers and getting those open and closed and loading into cars and car seats and all these things. You have to be strong when you're a mom. Yeah. So I just can't imagine, it's not worth having the pain and doing nothing. It's much better to at least do something that can help you be functional and feel stronger.
Move and exercise every day and have less pain and feel like I can function a little better. Or don't move or exercise and have more pain. And so people will say, because you'll hear this, oh, I do exercise and I still feel pain. That could be a reality.
Yeah.
The alternative is if you don't move, you potentially will have more pain. The final thing that we want to bring up is what you brought up earlier about the anterior pelvic tilt and how that can result in us wanting to waddle a little more, especially as we get into the later phases of pregnancy, and developing a little bit of an awareness around that. If you are doing strength training, if you are going on regular walks and stuff, that itself could help you become significantly more aware without even noticing it, just because you're doing regular movements that are going to engage your core. But there's always this discussion around, oh, can I do core exercises when I'm pregnant, when I have a growing belly? Or some people are nervous about getting more of that diastasis recti. Oh, I can't do core exercises because I'm going to have more diastasis recti. We also talk about that in episode 359 with Christina Previtt.
Yeah.
She talks a lot about that discussion around diastasis recti and how she's almost gone to the other end of the spectrum, saying like, we have no evidence that shows doing exercise increases diastasis recti, or doing core exercises, or even doing crunches, increases diastasis recti. But in our minds, like, if you're doing the core exercises, if you're doing crunches or whatever it is, it's going to help, again, give you that foundation of core strength for postpartum.
We also talked about the myths and facts of diastasis recti a little bit in more detail with Anthony Lowe in episode 317. So if this is something you want to understand about the myths and facts that are said and what exercises you can and cannot do, that would be a really good one. What you want to look out for in general, what I tend to look out for myself, is that am I coning and doming a lot? Like, I just want to know where my pressure is going. I already have a ton of pressure going out onto my belly. So if I can help to balance those pressures a little bit more with my back muscles, with my transverse abdominis, with my pelvic floor, well, then I just feel better supported overall in my trunk. So personally, I don't want to see a lot of coning and doming in my abdominals. Like, how can I modify? How can I change my positioning so that I feel the muscles I want to work and I feel more engaged throughout my entire core? So personally, not because it's research related, like that is where I feel most supported. But a large, percentage of your persistence of diastasis recti, because we are going to get that stretching of linea alba, that tissue between the rectus abdominal muscle that causes that diastasis recti. That is normal and that is positive. That's amazing ability of our body to stretch in that way to make room for a baby. So you're going to have diastasis recti throughout pregnancy. Now, is it going to persist? And most diastasis recti abdominis have a spontaneous resolution, but 33% have persistent diastasis 12 months postpartum. Now, this is largely due to genetics, not necessarily what exercises you did or did not do during pregnancy. So I think that's important to remember.
And you're also strength training. So you're also doing a lot of the other things as well that are going to best help you create that strong foundation.
And I'm still doing HIIT workouts.
And still doing HIIT workouts that you handle better than I do, arguably, even when you're pregnant. And so, core training. The main reason we want to bring that up in relation to that anterior pelvic tilt is developing that awareness. Like, how, when you're doing core training, can you develop the awareness of what your pelvis is doing? And if you can, to some degree, control, I don't know if that's the right word, but I think develop a dynamic awareness of what your pelvis is doing when you're walking, when you're doing different activities. So you're not just always completely dumping forward into that extreme anterior pelvic tilt.
And this is why it's so important to not only be doing exercises in one motion, right? Like just lunges and just squats and just, We want to go side to side. We want to do single leg exercises, especially pregnant. Like, you want to do single leg exercise. It just helps to support the whole pelvis and what you're feeling. And I personally follow the full body low impact plan. I'm now on phase 2 currently while we're speaking and recording this podcast. I have a girlfriend who's postpartum and doing it with me. So it's fun to be in like pregnancy, postpartum phases and be following the same plan and feeling supported within our bodies. And so this is something that, you know, if you do want something to follow, there are going to be modifications as the belly grows because it just takes up space and room. So sometimes stances need to change. Like I said, sometimes I don't do push-ups on the floor. I elevate them, or, you know, what else? Core work. If I start to feel like I'm coning a lot in my abdominal region, then maybe I modify to sitting instead of laying on my back, and I'm doing marches.
You to lay on your belly. You know, you're going to modify those.
I sit onto like the bench and I lean forward. And so I can still do a lot of exercises for my upper body like I'm parallel to the floor without being belly on the floor. So there's a lot of ways that you can modify. If you need to reach out during any point and you want to try the full body low impact plan, I'd highly recommend it. I'm always available for questions if you're like, I feel like I need to modify this, or is there a modification for this exercise? Like, I'm available. So it's a great one, and it helped support me last pregnancy, and it's supporting my body this pregnancy.
There's a free week trial. We'll have that linked up in the show notes. It's just jen.health/free trial. Movement is good. And especially during pregnancy, we want to get the information out there that movement is necessary. It's recommended. Of course, you're going to be seeing a doctor throughout pregnancy and can ask about modifications. If you're a part of our community, you can always ask us about modifications for exercise, aerobic, strength, working on the core, all good things to set up your foundation so you can have the most successful delivery and birth and postpartum recovery phase. Thanks for sticking around for that episode on back pain during pregnancy. Again, are you someone who is pregnant, has been pregnant, or is thinking about becoming pregnant, and questions you might have? Please comment below. Make sure to hit that subscribe button and notification bell before you take off, and we'll see you next time.